Om Swastiastu. Hi everyone. So we are from SGD B4. We will present our student project entitled How to Learn Medicine by Problem-Based Learning. So here are our members. In this presentation, we will discuss about 3 chapters. The first chapter is the introduction, the second chapter is the literature review, and the third chapter is the conclusion. Next. So for the background, as a student, learning method is always be one of the keys that leads to a successful learning. Research has revealed that learning approaches are not only impacted by some factors, such as learning environment and mood, but also by how the students experience it. We also know that as a medical student, we are needed to understand not just the medical theories, but also how to implement it in the real cases in our daily life. This is why we need to know what problem-based learning actually is and how can we implement this learning method in our study to enhance our skill and competency as a medical student who are going to be a medical professional. Next, we will continue to the problem formulation. We have 5 problem formulation in the student project. The first one is, what is problem-based learning? The second one is how to approach problems. The third one is, what are the advantages and disadvantages of problem-based learning? The fourth one is, how does PBL differ from other learning methods in medical study? And the last one is, how PBL can be administered in engaging medical study. We also have 5 objectives towards this student project. The first one is to give information about what problem-based learning is. The second one is to describe the learning process of problem-based learning. The third one is to illustrate the advantages and disadvantages of problem-based learning. The fourth one is to describe differences between PBL and other methods in medical study. And the last one is to give information about the implementation of PBL in medical study. We also have one benefit in this student project, that is give general information about problem-based learning, specifically in engaging medical study. The next one, we will discuss about the second chapter, the literature review.
What is problem-based learning? Problem-based learning is a way of learning by prioritizing solving problem in real life. This way of learning no longer makes the teacher or lecturer as a learning center, but it is the student who are required to be able to solve their respective problem through discussion with their friend. In contrast to the conventional learning system, which still make the teacher as the center, in problem-based learning, the student will be the center and the teacher or lecturer is only a facilitator.
PBL targets students' ability to face complex problems they will most likely face in the future. This also means helping students in career readiness. As stated, students also learn how to handle various topics or problems by determining what the processes look like. There are at least 2 main values that are trying to be implemented to students through PBL. First, take an approach that students build cognitive, collaborative learning. Second, the change in the roles of students and teachers. Here, the teacher is not considered the center of knowledge in the learning process. PBL does not only equip the students with knowledge, but also improve crucial skills. Such skills consist of critical and creative thinking, problem solving, communication, adaptation, and teamwork skills. Next.
Okay, so for the learning process of problem-based learning, there are few types of learning process with problem-based learning method. So one of the first practice of problem-based learning is in McMaster University by using 12 steps of problem-based learning from Brenda. So Brenda's 12 steps of PBL are first, clarification and definition of the problem, and second, analysis of the problem, and third, development of hypothesis and plausible explanation. And the fourth step is identification and characterization of knowledge that needed. And 5, identification of what is already known. And 6, identification of appropriate learning resources. And 7, collection of the new information or knowledge. And 8, synthesis of all the new information. 9, repetition of all or some of previous steps. The 10th one is identification of what was not learned. And 11, summary of what was learned. 12, or the last step, application of the knowledge to the problems. And the next type of learning process by PBL is the Maastricht 7-jump process. So this method was developed by Gijs Sellers in 1995 as a method of problem-based learning for future doctor. So the steps are: the first, clarify the problem; second one, to analyze the problem; third is brainstorming; and four, we have to conclude the problem; five, formulate the learning objective; and six, we have independent study; and seven, we will share the group result.
The other type of problem-based learning is Harvard 6 steps. Harvard Medical School have been used these methods for the past of 20 years. They initially intended to encourage students' motivation and also responsibility towards their independent learning. Harvard 6 steps are the written problem scenario are given to the group, and then the student group will describe and also analyze the problem. The group will identify the learning goals and will study separately and independently. Then the student group shared the results and discussed them together. The group synthesized and summarized their work. Last is the PBL method by the University of Sydney. Overall, problem-based learning steps by University of Sydney consist of 3 steps. There are generate, clarify, and also consolidation step. When the students will generate ideas or an issue to be discussed together from the material that has been given. These steps also aim the students to identify the learning objective. Then the students will clarify the information and rethink the situation. They will study the learning issue deeper and search for the identified material for the learning issue. Last is the consolidation steps. Here the goal is that the student can explain signs, symptoms, and also investigate and how the student will manage the patient. They will also evaluate the things that they did earlier. Next.
Problem-based learning has many advantages that benefit students in many forms as following. The first one is improving students' critical analysis. In PBL discussions, students are free to express and tell their ideas, stances, or solutions regarding the cases. PBL also allows students to not only discuss the correct and incorrect answers, but also to challenge the option in reverse to foster and broaden the understanding regarding the concept. The second one is portraying the idea of concrete implementation of the knowledge in real life. So through problem-based learning, students will be able to gain confidence, readiness, and deeper understanding of what they will face in real-life situation. By being exposed to real case, students are set to draw correlation between the theory and real-life problem and resolve it responsively. The third one is triggering students to be actively involved in the learning process. Students are being offered a genuine case that have not been discussed before and even more complex than the theory that they acquire through lectures. Therefore, students are more motivated and encouraged to become immersed in the learning process to gather information and answer their curiosity. And the last one is building interaction between students. The discussion flow in problem-based learning allows students to collaborate with others in order to meet the solution of the given problems. By the process and dynamics in transferring knowledge, each student will develop their communication skill and interpersonal skills with others. Next.
The disadvantages of problem-based learning. Apart from the huge advantages given when implemented as a learning method, it cannot be denied that problem-based learning has its own drawbacks. First, it consumes a lot of time. The student will consume a considerable amount of time to investigate and find solutions to the problems given. Students might feel stressed if they were given little time to study over again the theories correlated to the problem in order to solve the questions given. The second one, that it requires well preparation and really depends on student motivation. Student motivation, preparation, and prior knowledge plays an important role in the success of problem-based learning, as it requires critical thinking and strong motivation in order to solve the problems. It will be very challenging for students who lack experience and knowledge related to the topic to be able to give correct solutions to the problem. The third one is that problem-based learning is challenging to be implemented in larger classes. As there are many students involved in the discussion and lots of different opinions were given, there will be many storyline changes which can be confusing and difficult for students to deal with. This makes the problem-based learning challenging to implement in larger classes and requires several facilitators in order to get the discussion process well. The last one is that student requires time to adapt. Many students are unfamiliar with problem-based learning methods as they get used to lecture-based learning, or they have been used to only receiving lectures from their teachers without trying to implement the theory to solve problems. Next.
How is PBL being used in approaching into learning medicine? Martin and Saljo, a researcher, led think that learning approach are essential at making or breaking a student's learning process. These researchers then try to give learning tasks to students, and based on how students approach a subject, they are divided into deep learners and surface learners. Deep learners are the students that are really motivated and curious about the subject and pursue to learn more about the subject, while surface learners are students that only learn because they want to succeed in the subject or at least not fail in this subject. This led to the idea that learning approaches were the key to studying effectively, but recent studies showed that learning approaches were not stable psychological traits, since students can choose either of these approaches depending on the educational context in what they are learning. This educational context perceived by students was more influencing than the context itself. This led to the perception that educational context can change when curricula are changed. The most widely known learning approach, which is the problem-based curriculum or problem-based learning, was put to the test on first and second year students. This showed very good promises since their feedback were mostly positive with reasonably less problems.
As we all know, as medical science is advancing day by day, the need for better learning technique is very important. Problem-based learning is an effective way to provide a coherent, integrated, and focused medical education. Problem-based learning is becoming a component of the general curriculum in medical and health sciences around the world. To date, many medical schools in various countries have adopted problem-based learning. The main characteristic of PBL is that student learning is centered on problems. Students work in small groups to identify what is needed and learn to solve problems. Meanwhile, the teacher acts as a facilitator. And the rationale for the PBL approach into learning medicine is that its emphasis on real-world problem-solving develops students' capacity for clinical reasoning, facilitates acquisition of both basic and clinical sciences in a way that allows retention and transport to clinical assignments. Next.
Comparison between problem-based learning methods and others in medical study. There are two methods in learning system. There are student-centered learning and teacher-centered learning. PBL needs a more active student participation than the lecture-based learning. Students on a PBL course tend to place more serious on using resources such as the library and online resource. PBL students usually ask more efficient questions and use fewer questions to be able to complete the test. That discovery suggests that the PBL curriculum is very helpful to improve the questioning strategies of medical students and help them diagnose medical illness more efficiently in future life. Students more prefer to use problem-based learning over lecture-based learning for their study process because of motivation boost, a higher quality of education, knowledge retention, class attractiveness, and practical use. Next.
PBL methods have been shown to have higher grades and quality of their medical training than the traditional ones. This thing caused by PBL students more understanding what they learn and do, not just memorizing the knowledge like what non-PBL or LBL students do. The students who study with the PBL method was the first group who learned communication skill in their learning process, whereas many students who study with the non-PBL method learn it on the job or elsewhere. Students who study with the PBL method have better problem-solving abilities and more effective questioning skill than non-PBL students. This ability is so important because it will contribute to the doctor questioning patient and diagnosis practices, which medical students will use it once they become doctor. Effective questioning skill will greatly help medical students later to understand what our patients feel and think. It also contributes to patient comfort in their health care. Next.
The current implementation of PBL in medical study. Following quite a few years of improvement, despite the fact that applications fluctuate, PBL has been perceived all around the world and carried out by numerous clinical schools in the USA, Canada, Europe, Asia, and etc. So there is a table of relationship between PBL implementation and medical student achievement index. Results correlation coefficient between PBL and IP value students show the number 0.216, which indicates a positive correlation, which has meaning that the greater the implementation of PBL, the students are getting better too. On the other hand, the smaller the PBL in students, the student achievement will decrease. Next. Students were more drawn to the mixture PBL than the customary talk in the view of the assets, basic reasoning, methodology, and fascinating learning encounters that decidedly impacted the learning through the PBL process. Then ongoing investigations in Saudi Arabia, other studies felt that PBL was further developing the learning results areas, improving of learning capacities. Then the C200 educational plan, which depends on PBL, had turned into the sole educational plan for fundamental clinical science at Southern Illinois University School of Medicine, since they found, in light of their first PBL execution, that PBL was compelling for self-coordinated learning techniques and that it developed deep-rooted learning. Then the research from S.Ked that analyzed students' opinion about the implementation of PBL for bachelor phase of learning program in S.Ked showed that most students gave positive opinion on PBL if socialized in the beginning of learning process. So most of the students and doctors gave a positive opinion that and responses to the application of PBL in their learning. Next.
Okay, next, how could PBL be effective in its implementation? First, facilitators supervise student capability. Although the PBL method has become the most widely used in medical students, PBL still needs to be developed to increase its effectiveness. Sometimes there is some students that have not capability to initiate their own step and make them left behind from others. So for the future, mindset learning and advanced supervising from the education institution is needed in PBL method. A good and the next one is education institution capability to write a good case problem. A good case problem must include this factor on its case form. First, there is relevance. Relevance is how relevance between case problem, the topic, the real case, and its references. And the next is quality. Quality is how close the case from in comparison with the real life case. And there is dynamic group functioning, tutor performance, skills, and learning resources. And after few from these criteria, writing team must have a curriculum matrix that is used to develop the good case problem. This curriculum purpose is to maintain the quality of case problems. Okay, next.
All right, so the conclusion of this student project is problem-based learning method is a suitable learning method for medical study, as this method allows students to prepare themselves towards a real-life problems that are awaiting them, by giving them a real-life problem to be solved by providing their individually designed thinking flows to be discussed in group. Next. Finally, that's all our presentation about the student project. We are sincerely apologize for any mistakes in this presentation. From the bottom of our heart, thank you very much for your kind attention. Lastly, please excuse me to end this presentation with Paramasanti. Om Santi 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 Om.